Knock, knock. Did some hand hygiene. How we doing? How's that IV feeling? Perfect. All right, so you know the routine. We're going to give you some Dilaudid here for your pain. I checked out in the hall, checked the right dose, the right patient, the right time, the right route, the right medication. I've got my Dilaudid here. I'm gonna check the expiration, make sure everything looks fine on it, and then I got my normal saline expiration. All of that looks good. Can I get your name and date of birth? All right, perfect. Check the wristband. It's the right patient. So I check here. I've got my Dilaudid, got my MAR here. That I need to give 2 milligrams per milliliter and dilute with 2 milliliters of normal saline. So I am going to go ahead and do that. So you just go ahead and relax. So I'm gonna pop the top off that. I'm gonna clean both of the tops here. All right, so I'm gonna start with my Dilaudid. I need 1 milliliter of Dilaudid. So I'm gonna pull up 1 milliliter of air. Insert the air. Put my 1 milliliter. I'm going to recap this with the one hand method because I want that needle still on there. So in this one, I'm gonna put a needle on it and I'm gonna draw up my 2 milliliters of normal saline. So 2 milliliters of air. This is my normal saline. So I'm gonna recap this with the one hand method. Make sure I got all the air out of it. Perfect. So I'm going to take off this and dispose of the sharps. So now I'm going to put that to 3 because I'm going to put my 1 milliliter in there. So I'm going to take off this cap. I'm going to insert this needle. Actually, I'm going to pull back a little bit. There's extra air in there. All right. So I'm going to recap that with the one hand method. This is going to go in the sharps container. So now I'm going to make sure I have my 3 milliliters here. I have a label on it with the dose, who drew it up, the patient name, date of birth, and the date and time. So I am going to remove this. So we're going to clamp this off. All right, so we're going to give you some Dilaudid here for that pain. Is that pain still pretty high? All right, so I'm going to clean this off. You tell me if this burns, hurts, anything. I am going to push it over like 4 minutes so we can just sit here and talk. All right, so I cleaned that off. Make sure there's no air bubbles in there. Push that. Nope, I'm not gonna do that yet. I'm gonna make sure that that stays sterile with the IV. All right, so I'm gonna flush it 5 milliliters before. Sorry, got ahead of myself there. All right, how's that feeling? Good. All right. IV site looks great. There's no swelling, no nothing. So now I am going to put this on. We are going to push this over 4 minutes. For purpose of this video, I will push it a little bit faster, but I would push it over 4 to 5 minutes. So that's done. I'm going to throw that in the garbage. We're going to do one more 5 milliliter saline here. Is that feeling okay? Perfect. So we're gonna hang your last bag of your chlorpherin, and then we are just gonna discontinue this IV. So, all right, there's that. That feeling okay? Good. All right, let's see here. This tape is probably the worst part. So we're gonna get all this tape off of ya and make sure we're not bleeding too bad. Let me know if it gets to bleeding real bad or anything after we take this off. All right. Sorry. Get all that tape off before we pull out the IV here. Oofda. All right, so all the tape is off. Open up my 2x4 here. I have my tape ready, so I'll put that, hold some pressure on it. Put some tape over it, and I'm gonna dispose of this. All right, so I'm gonna make sure the patient is in a comfortable position before I leave him. I'm gonna go document how well he took this. I will come back here in a little bit and assess his pain after I push pain medications. I'm also gonna make sure that I keep track of his breathing, his oxygen, all of that, just because it could have too much sedative effect on him. And then make sure that we just kind of keep an eye on this IV site, make sure it's not bleeding too much. I will go chart this, and yeah.